This is the story of how an important IT data management system is born out of a critical situation, out of a crisis related to COVID-19 pandemic here in Montenegro. At the very beginning, we had a lot of people not being able to discern between several kinds of symptoms that they might be presenting at that moment and the COVID-related symptoms. So there were hundreds and thousands of phone calls to primary healthcare services in order to understand if they are exposed or not exposed to the risk, and people were also afraid to come, obviously, to to primary healthcare premises. So at the very beginning, a centralized call center was set up in order to answer the needs of the population. It was a call center that was able to do an automatic triaging, discerning between those who are exposed, who are really at risk of being exposed and presenting symptoms, and hundreds and thousands of others. All this could be done by epidemiologists, but we could use, in this call center, we could use volunteers, we could use also students of medicine, so we could ease the burden on epidemiologists at that moment, and we had a very scalable system. These quarantined people needed to be overseen, needed to be monitored. Instead of creating an app, which is a solution often used across Europe, we've opted for another option, much simpler. There was an SMS-driven system. The person which was quarantined received an SMS, and by following the link on that SMS, it opened a questionnaire about the symptoms. So at the end, it was a personalized questionnaire, so at the end, the local epidemiologist had red and green dots. Red needs some attention, green dots needs no attention, so their effort and their work could be focused where the need is required. We could cover 70 or 80% of quarantine population, where apps needed installations, needed memory, needed management, etc., etc. So very often in European countries, this app option was not particularly successful.